years of pharma experience in clinical trials and drug development in USA. He worked as a corporate SAS trainer for Fortune 500 companies such as Novartis, CTS, Alembic, and Liberty Mutuals. He works as a visiting professor for Southern Illinois University for business intelligence, clinical data management, and statistical programming. He is a highly organized, goal-oriented, independent SAS trainer for base, advanced SAS programming, clinical trials, business intelligence, and analytics. He has 10 years of teaching experience in field of statistics, mathematics, and computer science in various degree and PG colleges across India, and 20 years of SAS programming experience in big pharma companies like Pfizer, Novartis, Bayer, and Amgen. He also worked a couple of years for financial, insurance, and manufacturing industries in United States and trained thousands of pharma and biotechnology professionals across the globe, and they are well settled as statistical programmers in pharma industries. He has conducted many seminars at various pharma, engineering, MBA, and several universities in India and abroad. Now, I would like to invite our speaker, Venkat Ikkurthy Garu, to continue the session.
Thank you. Thanks very much for giving this great opportunity to talk to the young professionals. I think all of you are able to hear my voice and able to see my computer screen also, right? Okay. Thank you, everybody. Yep.
Yes, sir.
Oh, good. The pharmacy, like, if a doctor is making a wrong diagnosis, a patient may die. Same thing like a pharmacist is dispense a wrong medicine, same thing is going to be happen. Because that is the importance of a pharmacist in a society. Unfortunately, in Indian system, the pharmacists don't have that much of importance. Particularly in the US, if the pharmacist is in off, they are going to close their pharmacy. That is, suppose a clinical trial analyst like me, if I am going to take a wrong decision, thousands of people are going to affect you. So that is the case. Clinical trials and drug development and pharmacy students is interrelated. You know that like as a pharmacy student, you are able to get the opportunities to start your pharmacy. That is the first option. Pharmacy means working with medical shops or something like that. Second one is you can go to the manufacturing side, industry side. That is the second option. Third option is you can market the drugs also. You know, like what is metabolism, what is toxicology, etc. All these things, you know that. These three are you can market the drugs also. So these three are the traditional opportunities for pharmacy students. Now I am going to talk the alternative career opportunities. What are the alternatives for pharmacy and life sciences students? Alternatives for pharmacy alternatives for this pharmacy students is first thing is like clinical trials and drug development area, and pharmacovigilance, drug safety. Sometimes people call it as medical coding, ICD conversions, all these things. Out of all these alternative opportunities, career opportunities, which one is the best? That's I am going to discuss right now, because industry is looking for quality people. That's what I'm clearly explaining, that what is quality people. I'm really impressed with your college started in 2007, almost like close to 15, 16 years. The old college that contains B pharmacy as well as M pharmacy with the three disciplines, including even regulatory also. So that means so many batches are coming out. That means you have excellent infrastructure and facilities and library, all these things. Better, I'm encouraging all of you students, better to use the college infrastructure first. Better to use the library to get more information. So these are, because I saw like, your college profile seems to be very impressive, because your management has highly qualified and motivated to run the college in right direction. I really appreciate the whole management and the principal, and of course giving this type of opportunities to reduce the gap between industry and education. Okay, going back to our area is like. So I am a SAS programmer, I am a statistician, I'm working with this a lot of pharma companies for so many years. So as a pharmacy graduate, what is your intention? For example, after completion of my graduation, I want to enter into corporate. That is the target. Most of the students, 99.9% of the students target is they want to enter into corporate, or they want to go to abroad. So now we are going to focus those things. Suppose if you want to enter into corporate, whatever the traditional opportunities you have it, I don't want to touch those things. You know all those things. Now I am going to talk to a couple of other areas. Very first one is like SAS programming, SAS programming. And the second one is with drug safety and pharmacovigilance and medical coding, etc. See, nowadays this artificial intelligence and machine learning is taking a lot of these drug safety jobs and pharmacovigilance jobs, of course. And similarly for coding is like a one-time task, medical coding, and after that their jobs are gone, first of all. So other one is like most demanding area is right now is with SAS programming. What is exactly this programming?
Hey.
Certain things, when you are, that's the reason corporate professionalism is very important here. Our target is when you are conducting these type of sessions, we want to make sure that two things. One is with a professional approach. That's the first approach. You need to mute yourself. That's the first thing is. If you have any questions, don't be hesitant. You can put it in a chat window. Definitely we are going to address those things. Anyway, we have like 5 to 10 minutes of question and answer session. Probably your professors may ask some questions related to job opportunities, etc. Everything that we can do that. Most important is like when you want to talk, then only you can unmute it. Otherwise, you can mute yourself. That's the very, very important. Okay, going back here. Now, SAS programming. What is exactly program? Because I know that most of you people came from BPC background and few people come from MPC background. After completion of your BPC, then you started your MSET and you got a good rank and you got the opportunity here itself. So you don't have a good computer knowledge. That's the one thing is. Program means we need to give a systematic instructions. That's what exactly we want to give a instructions. That is nothing but program. Program means programming. Programming means one who writing a program is nothing but programmer. So you need to write a program. You need to write how you are going to write the programs, because I know a lot of pharmacy students. They came to US, even in India also. Few months back, one of my student, he completed his pharmacy degree in Vignan Pharmacy College, Vadlamudi, I mean close to Guntur, and he got the opportunity in Accenture. Now he is making almost more than 10 lakhs salary. So when you are going to get a 10 lakh salary, we are going with the traditional opportunities. So definitely SAS is one of the best option to enter into the corporate, first of all. Now, if we want to enter into the corporate, what exactly is required? What exactly is required? See, we need to go with like a SAS programming in pharma industry. What exactly is SAS programming? I told you like pharma companies' main business is, suppose you are talking about like Reddy Labs or like, Natco Pharma, all these companies, mainly they are like a manufacturing companies. They are not going to invent new drugs because already invented and patent is expired, they are going to make those type of things. So those type of companies, they are simply a manufacturing companies. But whereas who is inventing the drugs? Like Novartis, like Pfizer, like Bayer Pharmaceuticals. These companies are inventing a drugs. So how they are going to invent the drugs? How they are going to invent the new drug? So that is a long process. It's almost like a 10 to 12 years process. First, they are going to conduct preclinical trials. Preclinical trials is nothing but they are conducting these experiments with the mice. Then after that, second step is goes to rabbits. Then the third step is like if you go to like, sometimes monkeys, sometimes dogs. If they got a positive results, then they are going to file a application that is known as IND. IND means investigational new drug. Oh, we are inventing new drug. Then FDA, Food and Drug Administration, is review those applications, and they are going to accept it and go ahead with the clinical trials. Then the drug comes into first drug in human. Up to that, only animals. Now clinical trials is going to be started. That is the phase 1 and phase 2 and phase 3. After completion of the phase 3, they got a better results. Then they are going to file a application again, that is known as NDA. NDA is new drug application. Once the drug is got approved, then the drug comes into the market. This whole process is a minimum of like 10 to 12 years process. Some exceptions, particularly for coronavirus, is exception. Most of the cases, this much of time is required to get into the approval process. So for this case, I want to prove that my drug is safe. My first step is my drug is effective, my drug is safe. Then comparing with the existing drugs in the market, so many drugs are available in the market. I want to prove that my drug is more effective or less side effects compared to existing drugs in the market. If I want to prove these type of things, I want to provide this information to FDA, then only they are going to get approval. So for that case, think about it. Like this is for that case, what exactly a person is going to learn is required. He should familiar with the medical terminology. He should familiar with the pharmaceutical knowledge. You must be familiar with the basic statistics, not going like advanced statistics. Think about it. You are not a statistician. I'm telling that word again. You are not a statistician. Very basic statistics knowledge is required. Already you in your B Pharmacy, you have some statistics papers. That knowledge is good enough. Otherwise, you can get it. It's not a big problem. And the second one is with the programming. What is this programming? SAS programming is required. SAS programming is required. So if you know these four skills, if you know these four skills, definitely I'm very positive you are going to get an interview. In interview, you need to communicate. That's a very important part. The communication is required. So as again, you are all final year pharmacy students. Think about like final year. So now this is the right time for you to take a decision now, end of the fourth year or something like that. Then definitely you need to think about it. Oh, I want to go to abroad, for example. What you are going to do in abroad? In abroad, frankly, after 2002, a pharmacy graduate from India is not eligible to take NAPLEX examination. Again, I'm using the sentence again. After 2002, a pharmacy graduate from India is not eligible to take NAPLEX examination. So you are not going to become like a registered pharmacist. That is clear. So what you are going to do after completion, when you are going to abroad, for example, US or UK or Canada, UK and Canada is different, particularly in US. What you are going to do? In US, there are only two industries. One is with the medical, second one is IT. Only these two industries have plenty of jobs. Other than that, no. So you are not eligible to go to medical side. You need to come down to IT side. For that case, every pharma company, every biotechnology company, every like CROs, contract research organizations, they have a statistics department. In that statistics department, there are plenty of SAS programming positions are available. So better to acquire those positions. That's the one important part. Now we are going back to here. Of course, we are the winners of this New York Medidata conference before last year, actually. So this is my profile, actually. Like this. This is like, I worked as a manager in this Bayer Pharmaceuticals, and this is my contact information here in India and US. Now, here like this. Always think about it. Like I told you, like, so, and you see this, like 11 o'clock is our session means 11 o'clock, I am in on time. So most important is time is the more important part here itself. Always as a student, make sure that success and excuses do not talk together. If you want excuses, if you want excuses, forget about your success. If you want success, don't give any excuses. That's important. And of course, why I'm here is only because of education. So concentrate on education, the more important part. This is the important slide, actually. Like when you see this triangle of success, you want to get a success. First of all, you want to get a success means you want to enter into corporate. First of all, you want to enter into corporate means your college. is going to teach your basics, theories, information, facts, figures, description, learning, science, etc., etc., everything. Suppose people like us, we are going to talk about additional stuff, additional skills, but your attitude is like motivation, confidence, integrity, honesty, optimism, enthusiasm, cooperation, commitment. These are all very, very important for individuals. So that's why we can call it as ask. A represents attitude, S represents skills, and K represents knowledge. If you have all these things, then only you are able to get a success. So success is very, very important. How we want to get a success is not because of the subject, not because of attitude, not because of other things. If you have all these things, then only we are able to get a success. That's the one important thing you want to figure it out. Now, I told you, like, without statistics, without SAS programming, we are unable to conduct clinical trials. If you want to conduct a clinical trial, I need to prove that my drug is more safe. My first step is I want to prove that my drug is safe. Then next step is I want to prove that my drug is effective. It is effective. Then third step is there are so many medicines are available in the market. I want to prove that my drug has more effective or less side effects compared to existing drugs in the market. So all pharmaceutical and biotechnology companies are looking for clinical programmers like you having knowledge in medical terminology. Medical terminology, probably in your pharmacy regulatories, they are talking about like GXP, like 21 CF for Part 11, ICD guidelines. So much of things is there itself. Probably like you will get that information. It's not a rocket science. Then biostatistics. What is exactly mean? What is median? What is mode? What is standard deviation? What is variance and correlation? That's enough. That's knowledge is good enough. You don't go with more than that. Like I'm telling again, you are not a statistician. You are only a programmer and clinical research. Just now I explained about what is IND, investigational new drug, NDA, new drug application, SOPs, standard operating procedures, SAP, analysis plan, protocol, etc., everything. Those type of things is required. And what exactly we are going to do in phase 1 and phase 2 and phase 3 and phase 4. Then SAS programming. Probably you are all familiar with the first three, medical terminology and statistics and clinical research. Probably you know all those parts, but you don't know one thing is with the programming. That programming, I know that. That's the reason I'm telling you, most of the people, they want to learn SAS programming or they want to learn certain things. Suppose if you want to go with like a pharmacovigilance or if you want to go with like a drug safety. See, don't assume that like, somebody is coming and telling like, oh, I want to go with this. Don't do that. First of all, if you want to go with any programming, any new skill, first you need to ask one single question. Who is the faculty? First step is, oh, what is his first name and last name? Ask the first name and last name. That's very important. Go to the online and check with that person's first name and last name. Then after that, where he has experience. Hey, this guy has industry experience or not? If the person has industry experience, then you need to consider that's good actually. Suppose if he is he's a trainer or if it's a teacher, so it doesn't make any good sense because you want to enter into corporate. So corporate standards is required, corporate knowledge is required, how corporate is behaves. That is the important, because always across the globe, industry and education, industry is always top, education is always down. In US, the gap is little bit less. In India, gap is little bit more. That's only the difference. Gap is there. So our intention is we want to reduce a gap between industry and education. How we want to reduce the gap between industry and education? We want to explain them like what exactly the industry is looking for. Industry is looking for people with 360 degrees. That means people with overall knowledge. That means you should familiar with the medical terminology, familiar with the statistics. I'm using that word familiar with statistics and clinical research and the SAS programming part. You won't believe it. Like I think few days back, I took one session. $100 million, a big pharma company. That company name is BMS, Bristol Myers Squibb. They are starting a development center at Hyderabad. You know how much it is? $100 million. 1 million is equal to 10 lakhs dollars. Their goal is they want to hire at least 1,000 people this year, and they put their head count on 10,000 people in 5 years. That is totally a statistical programming and clinical research division. So that means we are having so much. Even Merck is hiring people, Eli Lilly is hiring people, Bayer is hiring the people. Lot of these companies, they want to invest lot of money in India, particularly in this programming side. Why they want to develop in Hyderabad or some other place? You won't believe that 251 engineering colleges in Hyderabad. 59 pharmacy colleges are in Hyderabad. 59 pharmacy colleges. 251 MBA colleges are in Hyderabad. Of course, 17 universities are there itself. Suppose out of this, if you are going to like Hyderabad, 60% of the people from Andhra Pradesh goes to Hyderabad, and they are able to get the opportunities. So this is the time you need to take a decision. The opportunities are there, but we need to go with in a perfect right direction. That's the very important part. I told you just now, there is a huge gap between industry and education. Of course, we are helping the people to reduce the gap between industry and education. Now, who wants to learn this? Pharmacy, life sciences students, biotechnology, medical graduates, statistics, of course, mathematics and computers. These people, because mathematics, statistics, computers people, they know only programming, they know a little bit about statistics, they don't know what is clinical research, they don't know like medical terminology, they don't know all these things. That means you people need to learn statistics and programming. Those people need to learn your knowledge. That is the important part. So that means in our curriculum, it is not possible to go with 100% overall. Is not possible. Certain areas you are comfortable, so you need to learn certain areas from outside. That is the important. And the next one is like, see, what is exactly SAS? I told you like SAS is a statistical analysis system. That is the software. Over 40 years, it started in 1975, I think. It is customers in 147 countries. If you see like 92 of top 100 companies on 2018 Fortune Global Star SaaS customers, you need to figure it out. Oh, if I want to learn this software, who is using this software? 100% of pharma and biotechnology companies, they are using SAS for their clinical CSR, means clinical study reports. If they want to develop a clinical study reports, they want to go with the SAS. 100% pharma and biotechnology companies. So that means there are plenty of opportunities are available, because who is giving the approval for pharma companies? FDA is giving the approval. FDA means Food and Drug Administration is giving the approval. So for that case, FDA is using SAS software. If FDA is using SAS software, that means all pharma and biotechnology companies, they are going to use the software. They don't have any other option. That is the reason SAS is pretty much is a good market, particularly for market. Because after completion of my graduation, after completion of my SAS training, I want to get a job. That's important. How we want to get a job? I told you like, you need to know all these things. In addition to that, you must have a corporate values, corporate ethics, and business communication. Those are all very, very, very important. Like, these are all the industries they are using this software: banking, communication, education, etc., etc. All these industries. That is the reason I mentioned 92% of Fortune 500 companies, they are using this software. Now, see 147 countries, etc., etc., everything here. The next one is like, this is the certification syllabus. Suppose, for example, you won't believe that like, you are studying your graduation 4 years or 5 years, whatever, 5 years. In particularly in US, we are always talking about number of hours. SAS training, how many hours is for, not how many days, how many hours is a 40 hours training session. It may be sometimes like a 5 days training session, each day 8 hours. That means that is the way continuously, constantly you need to learn. For example, creating temporary and permanent SAS data sets, investigate SAS libraries, combining SAS data sets, create and manipulate SAS date values. That is the thing. You can manage the data, how you are going to manage the data. And similarly, errors, how you are going to create, how you are going to identify the errors, then how you are going to eliminate the errors. That's very important part. And generating the reports and output, of course, this is the SAS certification syllabus. Then after that, you want to take the one examination. That examination passing score is not like your 35 or 45 or 50. Here passing score is 725. Remember this one, 725 is the passing score for 1000 points. Okay, so for that case you need to work hard. Then you need to take the examination. That examination contains 40 to 45 multiple choice and short answer questions. 125 minutes to complete the examination. That means close to 2 hours is the examination. Examination fees itself is like $180. So that is the examination. Once you got your examination, then of course, see, some students and faculty and staff may eligible for 50% discount on examination fees. So better you are a student, you can try this now like this. Once you have a certification, these are all the advantages, because your name is there in their website, certified professionals list, something like that. Definitely all these employers going to look for the certification part. That is the advantage. Increase your value to your employer, ensure credibility. A digital badge, you can put a badge in your resume, certified professional or something like that. That's the badge, you can get it. So these are all the advantages for certification. There are so many advantages are there, particularly for this. Now these are all the reasons we have SAS certification is, we are encouraging people to get the certification. First of all, as your final year student, people are asking, why I need to hire you? Oh, I have B Pharmacy degree. So almost 100,000 people are getting B Pharmacy degree every year. So you are one of the 100,000 people. 100,000 means 1 lakh people. You are one of the 1 lakh. You need to mention that apart from my graduation, I know I have SAS programming. I got my SAS certification. I got something like that. You have a more additional skill. Definitely that gives advantage to come into interview part. Once you have an interview, then you will get a job. That means every day you won't believe that so many people are coming into the market. So many people are. So today we awarded almost like 100,000 SAS credentials to individuals in 129 different countries. If you open this 100,000 SAS credentials, almost like 4,000 people are my students. They have got all certified professionals from across the globe. And the next one, this is a certification, SAS Certified Base Programmer so-and-so. SAS recognizes that this name is when it is 21st July 2008. And for credential verification, if you want to check with this name is correct or wrong, then you can go to support.sas.com, certify directory, etc. Everything here. When you click this link, you will find my name is there. So that's where they are going to check with you are really certified or not, because nowadays everything is, you are all with JNTU Kakinada, for example. JNTU Kakinada has, they are going to provide you information to some agencies. They are going to check with whether you have got your degree or not. Similarly here, Oracle Corporation, SAS, and Microsoft, they are going to provide you your name in their website. Or if you are certified, just to check it, then your name is there itself. That's where they are going to check with your credentials. Similarly, for this is for advanced programmer for this. And the next one is, these are all the symbols. If you got your SAS certification, they are going to provide you symbols like this: base SAS certified programmer and advanced certified programmer, something like that. Then you can put these emblems in your resume. Then definitely you are going to get an interview. I'm telling you. If you are going to, after completion of your B Pharmacy degree with your traditional opportunities, I don't know how much money you are making with your traditional, but if you are coming into SAS side, for example, I can assure you, you are able to get minimum of 7 to 8 lakhs per year, 7 to 8 lakhs per year. Within 4 years, within 5 years, your salary range is increases to 35 to 40 lakhs if you are in India. If you are coming into US or other countries, countries, that's a different. You can add a couple of zeros also. That is the salaries for the SAS programmers across the globe actually. So now we're talking about like, see why we want to learn, why we want to do all these things. Even you won't believe it. My time is midnight, 1 o'clock. Now it is like almost like, yeah, it's 2:05. Why I'm going to wake up by 2 o'clock and I'm going to talk to you? Because I want to talk to the students because they want to change their attitude. Nowadays, when you see this slide, in 1998, 170,000 employees worked at Kodak and they sold almost 85% of world photo paper. In few years, digital photography, digital cameras came into the picture. Kodak went to bankruptcy and all his employees went on road. They lost jobs. That's the situation. Now you know that like in India, like HMT watches, Bajaj scooter, Dianora television, Murphy radio, Nokia phone, Rajdoot, and even Ambassador. Now where they are, all these products? All these products now are in museum, not in the market, not in the road. All ambassadors are out. Rajdoot, no. Why? Because they are excellent products. See, all these are all not lacking of quality. They are excellent products. But why they are far from the market? Because they have not changed over the time. If they are not changed over the time, what happens? They are in the museums. Same thing in our cases also. Previously, your professor is read about Databricks professional. Why? When I got my Databricks recently, almost like 1 year back, I think. So continuous knowledge upgradation is very, very important. So similarly here also, if you are not able to change the time, see, next 10 years, world will completely change. 70 to 90% of industries running today will close. Pharmaceutical companies now, online pharmacies comes up. You won't believe it, like online pharmacies. Simply, if I want to get a medicine, what I'm going to do? I'm going to fax fax my prescription to the insurance companies. Insurance companies are sending that medicine to me directly. So that means that is the reason Rite Aid is a very big pharmaceutical chain in the US. They filed bankruptcy. CVS has filed bankruptcy. Why? Because after previously you will see Walgreens, Rite Aid, CVS, everywhere is there in pharmacy companies. Even India also, online pharmacy comes into the picture. That means all these pharmacy shops is in trouble. It is in trouble. So that is the reason you need to change. Business will change so fast. That means we need to learn the things also so fast. So people are thinking about, after completion of my B Pharmacy degree, I want to take a relax for a couple of months. Then after that, I want to think about what I need to do. So you are thinking it will take 4 months. Then after that implementation, another 6 months, total 1 year. So your juniors came into the picture. You and your junior goes for the interview. Who will get a job? Definitely your junior is going to get a job. Definitely. That means take a decision right away. And also, like a lot of times people are mentioning that, I have examinations, I have seminars, I have this, everything is there itself. Most of these classes, if you want to learn SAS, who is teaching weekend classes, for example, online classes. And that's the reason, again, if you select a right guru, I'm telling you what, if you are at right guru, you never did anything wrong. If you are not at right guru, whatever you are doing is wrong. Why? Immediately I accepted even by midnight because I saw your website. Seems to be one of the oldest college. It started in 2007. Seems to be good infrastructure. I went to your website. I check all that information. Okay, then this is a good. I need to talk to the people. But that's only the reason, because we don't want to waste our time, first of all. Okay, now going back here. Data revolution. We are always working with the data. You are working with the patient data, patient profiles, patient information. You are analyzing it because you know what is metabolism, what is toxicology, when this adverse event is going to become like a serious adverse event. All these things you know that, but only one thing is you don't know is programming. That programming you need to learn. Because in our education system, particularly in Indian education system, it's not possible you are able to get everything. because in US is not like that. I want to get my course credit. New education policy in India, it is going to be implementing from next year onwards. I think that is a credit based policy. In this credit based policy, whatever the courses is required, I am going to take those courses like US. Now not like that. You have a curriculum. You need to follow those curriculum. But in industry, they want some additional. That additional skills you need to get it from outside. There is no option for sure. So that means, so these are all the certain things of softwares we are going to use these things, Watson software, etc. Everything. Now, so now we are going back to here. The world is changing so fast. Keep your eyes and ears open, otherwise you will fall behind. Be prepared to change over the time. That's very important. If you want to go to abroad, you can start with your GRE, you can start with your TOEFL, and if you want to get after completion of my abroad education, what I need to do? What I need to do? I want to get a job. What is the skill set you have it to get a job in abroad? What is the skill set? That's very, I'm telling you, almost like, I'm working with a couple of American universities. Whatever the classes, whatever the education you are going to get it in your college is 1,000 times better than these American universities. But what exactly American university is going to do? They are going to give assignments. For that case, you need to go and you need to read the books. You need to fill the assignments. You need to write the assignments. That's where you are able to get the knowledge. That is the advantage, particularly for here. Particularly in higher education, US is the best. US is the best for sure. So a person must change his business and his temperament over the time. Time to time upgrade and upgrade. Time to time upgrade and upgrade. That's very important. Move over the time and achieve the success. Achieve the success means first you need to have a goal. What exactly you have it? My as a pharmacy student, my goal is I want to enter into like Novartis or Bayer or Pfizer or even CTS, somewhere else. What is your goal? If we have a goal, definitely your college professors or people like me, definitely we are going to help you how you are going to reach your goals. First, set your goal first. Okay. Most important thing is, you can see this one. The following 10 things that takes zero talent: being on time, like work ethic and effort, body language, energy, attitude, passion, being coachable, doing some extra you need to work hard, something like that, and being prepared. So if you have these 10 things, but you will get 100% respect, 100%. So make sure that always on time. That's very important, because if you're corporate, 8 o'clock means 8 o'clock. There is no exception. There is no exception. So that is the reason. Make sure that you need to change your attitude first. If you are working with the SAS side, SAS is not a rocket science. I'm telling that word again. SAS is not a rocket science. You will learn SAS very easily, very fast. But one thing is, you should have a commitment. That's very important. My intention here is, another meaning of real happiness is quality education. Not education, quality education. Quality education means it is having with a lot of additional things, good additional skills, better communication, how you are going to manage your time, how you are maintaining all these things is quality education. That's what we can do these things. See, this is like, I can explain, I can open my SAS server and I can do all these things, because this is too early for you to discuss all these things. Decide yourself. If you want to go with like a SAS workshop, for example, exclusively for SAS workshop, we can organize the SAS workshop, probably like, about 3 to 4 hours. So I'm going to explain how the programming looks like, etc. Everything we can do that. But one thing is, you need to make sure that what exactly you want to do. So clinical trials and drug development has excellent demand across the globe. That's the one thing. And I told you, you need to make sure that go to online and check with the BMS, Bristol Myers Squibb, Hyderabad, for example. There you will see 100 million. I have that flyer also. I have that paper clipping also. Then I will show that paper clipping is not a big issue. I will tell you that's the paper clipping I will show. Are you able to see my computer screen, right?
Yes, sir.
Yeah. 1 second. Now you are able to see another screen now. Bristol Myers Squibb Open Innovation Hub in Hyderabad. See, biopharma company BMS injects 100 million in New Hyderabad center. When you see this, Bayer Pharma offices are here itself. Opportunities in India. See, SAS programming opportunities, 12,94,804 per year in India. So I just now I mentioned around 7 lakhs or 8 lakhs, something like this. So we are going to work on these areas. Yes, definitely. If you want to get in, see, SAS statistical programming jobs. This is this one. I told you, like, a few days back, Hyderabad is Novartis office is here itself. There's one of the oldest biopharma office, the Bayer Pharma office is here. And when you see Bristol Myers and these companies, PPD, Peroxel, Quintiles, Syneos, Icon Clinical, like, Accenture, TCS, Wipro, Genpact, HCL, all these companies, they are hiring so many people. But that person should know a lot of things. A lot of things means a good degree, pharmacy degree with good percentage. That's very important. And the second one is with other knowledge, regulatory information. I don't know, are you familiar with the 21 CFR Part 11 or not? That is the one important part. Similarly, for ICH guidelines, International Conference of Harmonization guidelines. Similarly, for CDISC, SDTM, ADAM, etc., all these things. If you know those type of things, 100% you are able to get the interviews. Once you got your interview, then you can nicely you can communicate and you can explain these things. Definitely, that will be really, really advantage. And also, yeah, now this is the time for a question and answer session. Yeah, you can tell me, like, do you have any questions? Sopna, you have any questions here from students? Hello?